So you might have social support, but they might stress you in terms of demand.
So that's why you say people's perception of what their stressors are very important, because to someone on the outside, it would not be the least bit visible to them. So it's very important that we are able to articulate what our stressors are.
So when you feel these stressors, there's a biological reaction that happens in your body, and certain chemicals are released in your body that then go to target organs in your body and cause things to happen. So you know the fight or flight reaction, okay, that's because some hormones are released in your body which cause your heart rate to go up and you know you to get all jittery, and that's the same thing that happens. And some of those chemicals release or allow viruses which are latent in your body or asleep, because we talked last show about the virus when it gets integrated into the DNA can do three things. It can die, the immune system kills it, it can sleep there for as long as it wants, or it can start replicating. Well, when you have some of these stress hormones that are released in your body, some of them wake those cells up that have the virus in them. And the virus can even be released from the cell to go into other cells in the body and wreak havoc.
Now, it's very interesting you talk about the fight or flight response, because really our stress response evolved, I would think, to protect us.
Right.
We evolved in a very dangerous time when we needed to run from predators.
Right.
But now stress, I mean, we have a much more insulated life, much more comfortable life than certainly 100,000 years ago. And so stress, rather than helping to preserve us, run from predators, say, can actually work against us.
The problem is when stress becomes chronic. If it's just acute stress, you know, when you need to you know, flee for danger, that's okay. But it's when it's chronic that becomes a problem.
And loneliness is one of the big stressors.
Loneliness. So we are looking at loneliness as our measure of social isolation, which is equivalent to the rats. So across all our 8 studies, we're all looking at some measure of stress. And you know, collectively we'll be able to say something about how stress impacts the health of underserved populations.
And let's talk about poverty, because poverty itself is a tremendous stressor,
right.
which is probably why you can compare African women with women in Chicago, depending on class, socioeconomic background. How does poverty contribute to health disparities?
Poverty doesn't allow you to get, first of all, enough care for yourself.
Simple access to health care.
Access to care, but food, shelter that you need to keep your body healthy in the first place. And then the perceptions that, you know, living in those conditions puts upon you is another level of chronic stress in terms of, you know, I don't feel that I have as much income as other people that I know or other people in the United States, and you know, I can't afford this as well. So it just creates both, you know, actual disparities as well as perceived disparities that again act inside, you know, one's mind and then to the body.
Now, you said cervical cancer rates are significantly higher in this area than nationwide.
Yes.
Is that true of other rates of cancer as well in this area?
We work very closely with the Ohio Department of Health to analyze the cancer registry data, which is, we have a centralized incidence reporting. So these are new cancers, new cases of cancer. And we've looked, and the rates of cervical cancer, lung cancer, colorectal cancer are extremely high. Those are the major ones that are high in Appalachia, Ohio.
Do you have any idea why? Does it go back to some of the reasons you were talking about with cervical cancer, some of the lifestyle, lack of access, geographical barriers, no public transportation to be able to get?
Yes. In addition, we've talked about cervical cancer, some of the risk factors, but for lung cancer, the #1 reason, smoking. So we've already talked about the fact that there are higher than average smoking rates in Appalachia, Ohio. In terms of colorectal cancer, lack of screening. And it's not only a problem, you know, in Ohio, Appalachia, it's a problem across the United States. People don't like to talk about colon and that test.
And also, yeah, it's a very invasive test. I confess, the thought of it makes me incredibly, it's one of the few preventive tests that I have avoided.
Right.
And I'm, obviously, I mean, I make my living on preventive medicine. Right. And this is and this is a real problem.
Right. We could do a whole nother show on colon cancer.
And we are going to, actually,
okay.
this season.
But we are doing research in this area to try to get people to get screened for colon cancer. I'm a 2-time breast cancer survivor. And so, you know, if I can get anybody to get a screening test that will save their life, you know, I am all for it. And with colon cancer, the screening test that you get can actually prevent a cancer. Not only detect it early when you can be saved, but can actually prevent, because it can see the polyp and remove it.
And the doctor removes it right then and there. They're not just looking for possible precancerous lesions. They will take it out right then and there.
That's correct. And the embarrassment, the discomfort that you have will last only for an evening. I have had many a colonoscopy, and I can tell you it's just that evening where you drink the Go Lightly, have to go to the bathroom, you go in the next day for the test, they put you to sleep, you don't feel a thing, you get up, go home, sleep, and you're fine.
So how do we educate the population about how preventable so many of these cancers are?
I think we have to get to that mindset that, you know, people have to understand that there are ways to beat cancer. And it's not only just getting a vaccine, you know, to prevent cervical cancer, but it's taking care of yourselves by getting the screenings that you need to get, when you need to get them, and by taking care of our bodies, by eating, you know, and exercising. And that's the other issue I wanted to talk about in terms of why do we see higher rates, perhaps, of colorectal cancer in this area, is that the rates of obesity are very high in Appalachia, Ohio. And could it be linked to lack of physical activity? And again, if you have geographical barriers, there's no paved roads, there's no sidewalks that you can exercise. I have to work 2 or 3 jobs to keep my family, you know, solvent. There's no time for doing things like that.
And we should also say access to health care, and especially preventive health care, is a real problem in this country.
Right.
There's so much more to talk about.
Yes.
Unfortunately, we have to stop. I want to thank our guest, Dr. Electra Paskett, for upcoming episodes, viewer feedback, and links to important information on health. Log on to our website at the address that appears on your screen. Thank you for joining us on Health Vision, a production of the WOUB Center for Public Media.